Question 1. A nurse is caring for a patient taking digoxin. Which symptom indicates digoxin toxicity? A. Bradycardia and visual disturbances. B. Hypertension and irritability. C. Increased appetite and dry mouth. D. Muscle cramps and diarrhea. Answer. A. Bradycardia and visual disturbances. Question 2. What is the nurse's priority when a patient on captopril develops swelling of the lips and tongue? A. Place the patient in high Fowler's position. B. Administer an antihistamine. C. Assess airway and prepare for emergency care. D. Recheck blood pressure. Answer. C. Assess airway and prepare for emergency care. Question 3. A patient on lithium reports increased thirst and frequent urination. What is the nurse's best response? A. Reassure the patient that this is expected. B. Notify the provider and assess serum lithium level. C. Instruct to limit water intake. D. Schedule the next dose earlier. Answer. B. Notify the provider and assess serum lithium level. Question 4. A nurse is teaching about levothyroxine. Which patient statement indicates a need for further teaching? A. I will take the medication in the morning on an empty stomach. B. I will expect to see improvement in a few days. C. I'll notify the provider if I experience chest pain. D. I should not switch brands without approval. Answer. B. I will expect to see improvement in a few days. Question 5. Which adverse effect is most concerning in a patient taking an allopril? A. Persistent dry cough. B. Orthostatic hypotension. C. Facial swelling. D. Fatigue. Answer. C. Facial swelling. Question 6. A patient is prescribed metronidazole. Which instruction is most important to include? A. Avoid exposure to sunlight. B. Take the medication with dairy. C. Avoid all forms of alcohol. D. Take with iron supplements. Answer. C. Avoid all forms of alcohol. Question 7. A nurse is reviewing medications for a patient starting isoniazid. Which supplement is required? A. Folic acid. B. Calcium. C. Pyridoxine, vitamin B6. D. Iron. Answer. C. Pyridoxine, vitamin B6. Question 8. Which action is a priority when administering erythromycin for? A. Check liver enzymes. B. Infuse slowly to prevent arrhythmias. C. Administer with a full glass of milk. D. Monitor for constipation. Answer. B. Infuse slowly to prevent arrhythmias. Question 9. A nurse prepares to administer for ondansetron. What adverse effect should be monitored? A. Constipation. B. Bradycardia. C. Prolonged QT interval. D. Hypokalemia. Answer. C. Prolonged QT interval. Question 10. Which instruction should be given to a patient taking calcium carbonate for osteoporosis? A. Take with meals. B. Take with black coffee. C. Take on an empty stomach. D. Take with high-fiber foods. Answer. A. Take with meals. Question 11. A patient is prescribed methylorgonavine postpartum. What condition contraindicates this drug? A. History of anemia. B. Asthma. C. Hypertension. D. Gestational diabetes. Answer. C. Hypertension. Question 12. Which adverse effect of furosemide requires immediate intervention? A. Tinnitus. B. Frequent urination. C. Muscle cramps. D. Thirst. Answer. A. Tinnitus. Question 13. Which finding in a patient taking spironolactone should be reported immediately? A. Leg cramps. B. Increased thirst. C. Irregular heartbeat. D. Urine output of 600 milliliters in 8 hours. Answer: C. Irregular heartbeat. Question 14. A patient taking azathioprine is scheduled for routine labs. Which result is most concerning? A. WBC count of 2, 800/mm superscript 3. B. Platelets 170,000/mm superscript 3. C. Hemoglobin 12.8 g/dl. D. Potassium 4.5 milliequivalent/L. Answer: A. WBC count of 2, 800/mm superscript 3. Question 15. What is the nurse's best action for a patient on norepinephrine 4 whose infusion site is swollen and pale? A. Stop the infusion and notify the provider. B. Elevate the extremity and apply warm compress. C. Apply pressure to the site. D. Restart the infusion in the same vein. Answer: A. Stop the infusion and notify the provider. Question 16. A nurse is caring for a patient who just started taking risperidone. Which findings should be reported immediately? A. Weight gain. B. Drooling and muscle rigidity. C. Insomnia. D. Headache. Answer: B. Drooling and muscle rigidity. Question 17. A nurse is administering for iron dextrin. What precaution is essential? A. Infuse rapidly to prevent hypotension. B. Monitor oxygen saturation continuously. C. Administer a small test dose first. D. Avoid giving with vitamin C. Answer: C. Administer a small test dose first. Question 18. What is the nurse's best action when a patient taking glargine insulin experiences a fasting glucose of 70 milligrams per deciliter? A. Hold the insulin dose. B. Administer half the dose. C. Administer the full dose as prescribed. D. Give a carbohydrate snack and skip the dose. Answer: C. Administer the full dose as prescribed. Question 19. A nurse is caring for a patient receiving cisplatin. Which assessment finding is a priority? A. Blood pressure of 110/68 mmHg. B. Report of tinnitus. C. Mild nausea. D. Decreased appetite. Answer: B. Report of tinnitus. Question 20. What is the nurse's best action when a patient taking carbamazepine reports fever and sore throat? A. Encourage warm fluids and rest. B. Document and reassess in 12 hours. C. Suspect agranulocytosis and notify the provider. D. Instruct to take with food. Answer: C. Suspect agranulocytosis and notify the provider. Question 21. Which lab value requires immediate attention in a patient taking heparin? A. Platelet count of 55,000/mm superscript 3. B. APTT of 45 seconds. C. INR of 1.0. D. Hematocrit of 39%. Answer: A. Platelet count of 55,000/mm superscript 3. Question 22. Which findings should be reported immediately in a patient receiving for ceftriaxone? A. Diarrhea. B. White patches on the tongue. C. Difficulty breathing. D. Pain at foresight. Answer: C. Difficulty breathing. Question 23. What is the nurse's best action before administering metformin to a patient scheduled for a CT scan with contrast? A. Ensure patient is NPO. B. Hold metformin before and after contrast. C. Give with food to prevent GI upset. D. Administer with 8 ounces of water. Answer: B. Hold metformin before and after contrast. Question 24. A patient on gentamicin complains of ringing in the ears. What is the nurse's priority response? A. Reassure the patient. B. Hold the dose and notify the provider. C. Encourage fluid intake. D. Administer acetaminophen. Answer: B. Hold the dose and notify the provider. Question 25. What findings should the nurse report immediately for a patient taking clopidogrel? A. Bruising on arms. B. Blood and stool. C. Mild nosebleed. D. Headache. Answer: B. Blood and stool. Question 26. Which patient teaching is most important for someone starting amiodarone therapy? A. Take with grapefruit juice. B. Report any vision changes or dry cough. C. Avoid high-fat meals. D. Limit fluids to reduce edema. Answer: B. Report any vision changes or dry cough. Question 27. What should the nurse monitor most closely in a patient receiving for acyclovir? A. Renal function. B. Liver enzymes. C. Blood pressure. D. Blood glucose. Answer: A. Renal function. Question 28. Which finding in a patient taking phenytoin requires priority follow-up? A. Gingival hyperplasia. B. Unsteady gait. C. Drowsiness. D. Nausea. Answer: B. Unsteady gait. Question 29. A patient taking prednisone for COPD exacerbation has new bruising and delayed wound healing. What is the cause? A. Adrenal suppression. B. Increased blood glucose. C. Immunosuppression. D. Drug allergy. Answer: C. Immunosuppression. Question 30. A nurse prepares to administer 4 potassium chloride. What action ensures safety? A. Infuse by 4 push for rapid correction. B. Mix with dextrose solution. C. Use an infusion pump and dilute appropriately. D. Administer undiluted in a central line. Answer: C. Use an infusion pump and dilute appropriately. Question 31. Which symptom in a patient taking sertraline indicates the need to notify the provider? A. Increased appetite. B. Dry mouth. C. Restlessness and confusion. D. Drowsiness. Answer: C. Restlessness and confusion. Question 32. What is the nurse's best response when a patient on diltiazem reports dizziness when standing? A. Discontinue the drug. B. Instruct to rise slowly from sitting. C. Hold the dose and reassess. D. Administer oxygen. Answer: B. Instruct to rise slowly from sitting. Question 33. Which adverse effect should be closely monitored in a patient on lamotrigine? A. Insomnia. B. Rash. C. Constipation. D. Tremor. Answer: B. Rash. Question 34. What is the nurse's priority when giving 4-morphine to a postoperative patient? A. Assess bowel sounds. B. Evaluate pain scale. C. Monitor respiratory rate. D. Check urine output. Answer: C. Monitor respiratory rate. Question 35. Which instruction is appropriate for a patient starting atorvastatin therapy? A. Take with grapefruit juice. B. Report unexplained muscle pain. C. Take before bedtime with food. D. Double the dose if one is missed. Answer: B. Report unexplained muscle pain. Question 36. A nurse receives lab results for a patient on warfarin with an INR of 4.8. What is the appropriate action? A. Hold the dose and notify the provider. B. Administer the next dose as scheduled. C. Give additional warfarin. D. Encourage the patient to take aspirin. Answer: A. Hold the dose and notify the provider. Question 37. What is the best teaching for a patient taking methotrexate for rheumatoid arthritis? A. You may consume alcohol in moderation. B. Take folic acid supplements as directed. C. Discontinue if you feel well. D. Avoid all vaccines. Answer: B. Take folic acid supplements as directed. Question 38. A patient prescribed codeine reports drowsiness and constipation. What is the nurse's response? A. Decrease the dose. B. Administer a stimulant laxative as needed. C. Stop the drug. D. Change to 4 route. Answer. B. Administer a stimulant laxative as needed. Question 39. Which statement by the patient taking colchicine requires correction? A. I'll stop the medication if I get diarrhea. B. I'll take this to prevent another gout flare. C. I can take this medication on an empty stomach. D. I'll take it daily to build it up in my system. Answer. D. I'll take it daily to build it up in my system. Question 40. What is the nurse's first action when a patient on 4-lorazepam becomes difficult to arouse? A. Call the rapid response team. B. Prepare to administer flumazenol. C. Elevate the head of the bed. D. Recheck the sedation scale. Answer. B. Prepare to administer flumazenol. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.